Okay, today I'm going to talk to you about equine pyroplasmosis and some potential treatments if you end up with a horse that has this particular disease. First, we'll just go over a little bit about what causes the disease, and it's a protozoan parasite that is a lot like malaria in that it gets inside the horse's red blood cells, and that is where it exists when it's inside the host. And there are a couple different strains of protozoa that cause the disease in horses. Thaleria equi, which is more resistant to drugs and is harder to clear from the horse's system and just a little harder to treat overall. And then Babesia cabai, which is more susceptible to drugs. It's easier to get it completely out of the horse's system, and is just, if you had to pick, you probably would prefer this strain, although it's worth noting horses can have both of these strains at the same time. And these parasites are endemic to much of the world's horse population. It's estimated that only about 10% of the horses in the world live outside of regions where this disease is present. The U.S. is just lucky enough to be one of them. And there are multiple tests that can be used to detect the presence of either of these parasites, or both of them, whatever the case may be. So you've got options if it looks like your horse might have it. This is just an image showing some red blood cells. The darker purple inside of the red blood cells is actually the parasite, just showing that it is a lot like malaria and that it gets all the way in there. There are a few different species that can catch pyroplasmosis in general. Obviously, for this class, we are interested in horses, although these two strains can get into equines in general. But there are other strains of this type of protozoa that can affect other hosts, or infect other hosts. For instance, there's a strain that can cause the disease in dogs. This disease is important in my mind because it's got a fairly high mortality in naive hosts. Somewhere around half of naive hosts that catch the disease die. So since the U.S. does not have the disease naturally, but the number of horses that travel internationally are increasing, I think it's important that we establish that there are some ways to treat the disease so that we can keep it from becoming a problem in the U.S., especially because these protozoa are transmitted through vectors. They're tick-borne diseases, or a tick-borne disease, and there is at least one species of tick native to most of the U.S. that could carry the disease should it become present in the U.S., although there are some horses that have been imported over the last few years that have had the disease and been treated, and we've kept it from spreading so far. And there's also at least one herd of horses in the U.S. that was imported many years ago that it turned out they've got it, so they just have to keep an eye on them and probably use some of the treatments I'm going to tell you about in a minute to make sure the disease stays contained so that it can't become a problem for the rest of us that own horses in the U.S. Now, like I said earlier, the B. cabai strain, if you've got to pick, you probably want this strain because it is more susceptible to drugs. You've got a lot more options when it comes to treating it, and depending on your goal from treatment, whether you want to just treat symptoms and get any adverse symptoms of the disease in check, or if you want to try to completely remove it from your horse or sterilize your horse, you can choose between some different treatments. Imidacarb, depending on your dosage and your number of treatments, can be used to either control symptoms or attempt to sterilize your horse. Basically, you double your dosage and your number of treatments, but you spread the treatments out some. Dimenazine acetate can be used to treat symptoms, and then once again, depending on dosage, imidacarbolide can be used to either treat or attempt to sterilize. Each horse is a little different, so your luck or the effectiveness of these drugs could vary a little bit. When it comes to the T. equi strain, again, this one is more resistant to drugs. We don't have as many good options for treating it, although it's still being looked into. But you have to go back to your imidacarb dipropionate and a relatively high dosage. The recommended dosage is 4 milligrams per kilogram in 4 doses, spaced 3 days apart. And this is actually a very high dosage. It is half of the LD50 dose. So there is a potential for some adverse side effects, but at this dosage it should definitely treat symptoms and also has pretty good odds of sterilizing your horse. But an LD50 dose is lethal dose 50, which is to say that at that dosage, in like a laboratory setting, half of the test subjects would die. And we're talking of half of the lethal dose 50 dose, which sounds a little confusing, but basically it's a large dose. There are some potential for some side effects, negative side effects, which segues into my next point, that you've got all of these options for detection and treatment, and you should definitely consult with your veterinarian if you end up getting equine piroplasmosis on your farm, because they will be able to help you pick the right dosage and the right drug. But my goal with this presentation was just to introduce you to a disease that you may not have heard about before, since it isn't endemic to the U.S., but that I feel has potential to be a really big problem for U.S. horse owners if we do not stay on top of testing and treating it when it shows up. So I just wanted to show you kind of what the disease was, and that you do have some treatment options if you ever encounter it.